And good morning, everybody. This is the Monday, Easter Monday. I'm Claudia Romo Edelman, founder of World Human Foundation. Welcome to our daily 11 a.m. EST webinars, the webinars that we're trying to bring together for all of you, leaders of the Hispanic community, to be better informed and educated so that we can take better decisions and use this time to learn something, to upskill to train our skills and understand the implications that COVID has on us. This is part of the Hispanic Response and Recovery Plan, and today I'm delighted to have an incredible guest with us. His name is Ricardo Reis, and he's the A.W. Phillips Professor of Economics at my alma mater, the London School of Economics and Political Science. Ricardo says that there will be a medical solution to this virus with a better treatment and a vaccine. However, the social and economic fallout will continue long after. Governments and international organizations will need to look again at the effectiveness of their health systems and at the need to a better international collaboration. I want you to join us and hear from Ricardo Reis from the London School of Economics to discuss economic implications of COVID-19 and find out ways in which we can collaborate to mitigate the long-term impact of the virus. And that, Ricardo, is precisely what we're doing here at the Hispanic Response and Recovery Plan. We know that COVID has incredible health implications for all of us today, and we are thinking about that right now because that's the now. But there will be a near and then a next. And we know that in the now, Hispanics are the most affected health-wise, but also in the near, we're most affected economically, Ricardo, because we're losing our jobs, our contracts, our income. All of a sudden, we've been working in those services, in those industries that have been shut down completely. We know as well that we are going to really have to put together, be 2 steps ahead to look at this, to look at the recovery plan. How do we get out of this one? And how do we get out of this one together? And for that, I join you. I welcome you, Ricardo. Please tell us about the economic implications of COVID-19 and how can we get ahead of this?
Well, first of all, thank you very much for having me. It's a pleasure to be here in these trying times where we're all struggling a little bit to make sense of what's going on around us. But where it's important to know that in face of all the uncertainty, it is still the case that we do understand at least some of the logic and the basis of what's going on in the economy. And there is a sense of what needs to be done and therefore a way forward from this. So let me start by saying that first of all, and clearly, as you said, this is a health crisis. I am not a health expert, nor do I pretend to be one, but I think we've all been informed enough by the health community what needs to be done right now when it comes to preserving people's lives and in terms of being able to get us back on track to our normal lives as soon as possible. And if the economics intersects with that, it's only insofar as saying that, of course, as of now, any money spent on ventilators, on developing tests, on working towards vaccines is money very, very, very well spent. And that's something where there's really no economic trade-off there. We should just spend as much money as it takes to do that. It doesn't take that much money and it has an enormous impact on people's welfare. So on that one, I think it's important to understand that there's really no trade-off. This is not the time to save on the ventilators, people's lives, or on investing in vaccines and giving the researchers the needed resources for that. What becomes a little more troublesome is when one moves beyond just the immediate health impact and thus funding of the health response, is what do we do to the economy as a whole? And right now, essentially, what we're doing is freezing our economies, and we're freezing them both because to protect people's lives, because the economy is nothing but all of us interacting with each other, providing service to each other, buying and trading with each other. And that for our safety now has to be halted. And so what we need is to freeze all of these economic transactions. Doing so, though, as when one freezes a piece of fruit, or not so much a piece of fruit, but a piece of meat in the refrigerator, you want to freeze it such that on the one hand, you only freeze as much as you need to. You don't want to freeze all your meat because otherwise you're going to starve. You're not going to have anything to have dinner tonight. But also that when you freeze a part of it, that when you go in and freeze it a month from now to eat it, you will be able to unfreeze it and keep as much flavor and as much of the nutrients as you can. So challenge number one, how can we, given that we need to freeze the economy, don't freeze all of it right now, Well, that is a lot of the ability for us to work from home, the extent that firms can help workers migrate to work from home, to the extent that it's our civic duty now to be able to produce as much as we can given these trying circumstances, knowing that for many sectors that is impossible. It is impossible, let's say, for a restaurant to serve customers, but it is part of entrepreneurs' duty now to think of, can I do deliveries, and to what extent can I set up a network of doing so? It is impossible for me to teach my students, but I can say, to what extent can I use the technology that we're using right now to teach my students? So seeking those alternatives is nothing but trying to freeze less than what we had before. Second, then, comes the unfreezing part. Now, when we unfreeze the economy, when we wanted to be able to give us its nutrients again, its GDP, its output, its wealth, its income, what we want then is to have done minimal damage through this freezing. That is a very difficult challenge because, of course, if I now tell, let's pick again on a restaurant and say, well, right now you really can't serve anyone for the next couple of months, let's say, then, well, to the extent can that restaurant then in 2 months reopen its doors in exactly the same place with the same great chef and the same great service and serving the same set of customers? Well, the difficulty there is, on the one hand, for us to keep everything frozen, then the restaurant owner would have to keep on paying the payroll, the rent, to keep the space and to keep the workers and all of that. But of course, that restaurant owner right now is getting no revenue. He's getting no income at all. So how can he ever sustain that? Well, one option, and one that has been very much used, especially on this side of the Atlantic in Europe, has been, what if the government lends you the money for you to pay your rent, for you to pay your workers, such that everyone can go home for 2 months and come back? In that sense, it's not very different from when, let's say, we send people home during parts of August because they go on holiday.
Ricardo?
Is to say, well, what if we simply boost up unemployment insurance and we tell the restaurant, look, feel free to fire your workers. No, keep their contact, make sure you keep their phone number. They will be paid unemployment insurance for the next 2 months. And then in 2 months, you can just call them up and reopen with hopefully the same workers and similar customers and others. So that's an option that's very much more followed in the US. Unemployment insurance plus a combination of checks for people because of the gaps in the coverage of the unemployment insurance system in the United States. So that's another option to freeze, to then unfreeze. Now, will these be, finally, a third one is the banks. Well, the banks also want to collect their credits, but for the banks to collect their credits, a difficulty is that, again, a lot of people are not collecting the revenues. And so in different countries, the US not yet, there have been moratoriums on that, or there have been just generally support of the central bank and financial regulators to allow the banks to roll over loans and not demand payment while we're all closed, such that when we're back, then we can pay. So those are more or less the different dimensions through which we're trying to figure out how to do this unfreeze with minimal damage. Will they work well? Well, for sure, they're not going to work perfectly. For sure, there are going to be some workers who lose their job now are going to find out that the job isn't there again. For sure, when we come back, people are not going to perhaps want to go to the same restaurants the same way that they did if it's a tight space or not. But in trying to minimize and trying to keep the productive capacity of the economy, that's really the main priority now. And if you're trying to make sense, and the listeners are trying to make sense of why do we have all these measures, so think about them as that. We're just trying to make sure that when we unfreeze, when lockdown ends, we can go back to business as usual with as less disruption as is possible. Then, after, when the reopening happens, we want indeed people to try to get back to work as quickly as possible. And this is where the big unknown is whether this is going to be a prolonged, difficult recession or just a lockdown for a couple of months. Meaning, depending on how much that productive capacity will be destroyed, how long will it take for the workers who lost their job to find new jobs, for the entrepreneurs who lost their customers to find new customers, for the locations that got lost, for you to be able to find a new location for your business or not. That is a big unknown. Now on that one, of course, the only example we have of something similar is when we had thousands of troops coming back after fighting World War II in Europe to the US. And the government had to intervene massively through job training programs, through job matching, through providing free college, the famous bill that allowed a lot of vets to go to college and others, in order to allow, again, all this movement of people to come back and be reabsorbed by an economy. But also economies in Latin America, or even in Europe, for instance, or in Asia, Israel being an example, sometimes we go to these cases where we have 1 million people just show up. Well, Brazil is going through this now with the amount of Venezuelans that entered, or a couple of years ago, that enter the country. And so how do you absorb a lot of people that just come back into action to an economy is the other big priority. We have some experience doing this. It's never painless, but it can be done. And that's some of what is on. Finally, Claudia, I would note also, a difficulty with all these programs that I told you, both the government helping as well as the government providing support to the unemployed or to the firms right now, is how do you pay for it? The way to pay for it, perhaps abusing a little bit the war analogy, is to borrow. In these circumstances, we borrow in order to be able to sustain the productive capacity, in order to help the economy, knowing that we'll pay this off over the next 5 years, 10 years with the income that we make then. Now, right now, the only institution that is able to borrow in significant ways is the government, which is why we're seeing a lot of government borrowing. But the question that is harder is, how do we pay for that borrowing? So I start with immediate response. After lockdown, if you want more in a 5-10 year, the real outcome is going to be how are we going to pay for all the expenses that we're having now? And here there are different options, and they're not easy options, but they're the kind of options that an informed public and must make using our democratic institutions. Should we say that those that get help now are the ones who pay for it? So the firms that get help now, will they have to pay a cut of their profits in the next 3, 4, 5 years? Do we say that the people who received support and employment insurance now, should they now pay an extra income tax in the next few years? So in that sense, the ones that are helped now are those who pay for it. That's one option. Another option is to say, no, let the next generations pay for it. Let's our children pay for it. Let's just accumulate public debt and let the taxation over everyone in the next, say, 10 years from now, pay for the help that some got now. Again, when we fight wars, we think that's fair. Let the next generation, they'll benefit from the peace. Let them pay for the benefits of peace. Is that true now? Is it not? I don't know. Or thirdly, do we want to have indeed instead the central banks through inflation pay for it? And do we just want to have a lot of inflation paying for it, where that inflation, if you want the cost of that, gets spread through more? That's I think is a tougher question, and one that, again, if we look at the example of wars or other instances, or again, when we have a lot of refugees entering an economy, different options are made. Usually it's a different mix of all three, and that's one that I think is still very much open.
I think this is fascinating. I have a million questions to ask you. And I know that, like these webinars are 20 minutes, but again, I hope that you can join us again in the future, particularly for two things. The first one is to keep discussing and keep understanding the evolution of where are we going. And number two is because, Ricardo, we need to actually get a lot of brains around, particularly, like for that care about the Hispanic community around, like, what do we need to do to recover? What's a recovery plan, and how do we put it together? So I would welcome you again to join us and be part of what we're doing. I have a number of questions. The number one is, are countries all along getting a standard response, a unified response? Is it worth to have every country somehow having an international plan, Marshall Plan? Number two, we've heard a lot here about, like the different shapes of the recovery that we can have, V, U, L. I think that I heard at the beginning a lot of optimism about having a V, sharp down, sharp up. Now, like seeing a U, and the U will become back really next summer, not this summer, but next summer in 2021, which means that a number of people, particularly, like I see here in our participants are in the tourism industry, hotels and so on. So what does that mean for them? Does that mean that the behavior, the consumer behavior will change dramatically and people will not want to be traveling internationally anymore? So one is the global perspective. Do we have a standard? Are you satisfied how countries are cooperating internationally to get out of this one together, based on the three responses or couple of responses you gave? And also, like, how do you see the shape of this recovery happening and when?
So on the international dimension, let me answer in three parts. The first one is the health dimension, which is there clearly we need cooperation, because imagine if the United States now does all it can to contain the virus, but Canada does nothing, then insofar as people cross that border, then the virus is going to come back. There's no success in a lockdown policy unless your neighbors do it. Likewise, in developing the vaccine and developing treatments, ways to surveil, there's clear economies of scale that it makes sense that we're collaborating some way. Second, on the economic front though, and what are the right measures to freeze and unfreeze the economy, there it makes sense that we see some different responses. For instance, and I already alluded to that earlier, it makes in Europe, where in many European countries, the government has and the state has very good information on all the firms, they report their taxes every month, they're all connected online to the state records. It was relatively easy for Denmark and Germany, who were two leading examples, to roll out a program whereby they said, we know your payroll because we know the payroll of every firm because every month you're declaring it to Social Security, sometimes even for VAT reasons, your sales tax, you're declaring it every day what you work. We know exactly how much payroll you pay. Here's a loan right away. I can approve this in a few days and do it from the state intervention. Likewise, Switzerland's a good example where helping small businesses is very hard everywhere to reach them. In Switzerland, though, there's such great records. Every small business is registered. They have to connect their cash register to the tax authority to collect tax every day. It took Switzerland 48 hours to implement a loan program to small businesses, restaurants, hairdressers, and others. Look in the US on the other hand. In the US, we have a fairly weak government, let's say, or weak capacity, for good reasons, by the way, on why the government can't reach most small businesses. It's just there's no record of them. There's no way to communicate them. It's very hard to, they file taxes once a year and then you learn about them. In the meantime, half of them have disappeared, half have reopened. Therefore, in the US, it was very hard to do this. So instead, the response was much more based on unemployment insurance. Since we can't reach them, we can reach people through the unemployment insurance system. It's a system we have that works. So let's do it that way. Now, that doesn't mean that one is better or worse. It's basically what was possible given the emergence of what needed to be done then. A third part of the answer to that is, because you mentioned the Marshall Plan, is who should pay for it? In dealing with a problem in Italy, should it be shared by all the Europeans or just by the Italians? In dealing with a problem in Barbados or Mexico or Venezuela, should it be the Venezuelans or should we share this insofar as, those are the questions that have to do with your third part of, do we want a Marshall Plan where we say, well, those who did better should help out those who did worse, or does each country rely for itself? Your second question now, U, V, W, and all different letters. So if you can follow my pencil, now we froze the economy. The economy fell sharply, extremely sharply. While we're locked down, there's no way we could, GDP doesn't fall from trees. We have to work. We have to be at our workplace. We have to be serving people in restaurants to it. Obviously, when we leave the lockdown, we're going to have a sharp recovery, even if only just because people can go to work. So for sure, we're going to have a sharp recovery. The question is, are we going to recover back to the initial level or not? That would be a perfect V. For sure, we're not. For the reasons that I told you, in the unfreezing process, there's going to be some loss of productive capacity. So there's going to be some sense in which it's going to take some time to mask some people. So now the question then is, given that then that transition, do we have that after the sharp recovery that we're going to have in the quarter or in the month when the lockdown ends, it's not going to reach the peak. Will it then take 2 months, 6 months, or 1 year to get back to the previous peak, or even 2 years? That depends on how well we do now. It's not a law of nature, but it is something that policymakers should take responsibility for. If we do a good job on freezing and freezing, just like if I unfreeze a piece of lamb very well, that when I unfreeze it, I can eat almost all of it. If I do a bad job of doing it, then I lose some of it, and then it takes me a while to buy another one. And then finally, third, and that one though is perhaps so beyond then the V and W, is whether do we ever go back to the previous peak? And that is a difficult question precisely for the reason you said, which is the tourism and more generally the hospitality industry, which is, will we be comfortable sitting in restaurants, traveling in crowded airplanes in the same way that we were before? On that one, I think the economic answer is definitely subordinate to the health answer. If in 1 year, hopefully in 3 months, but let's say even 1 year, the virus has been completely eradicated, I see no reason why we can't go out as we used to and do the same tour as we did before. If it is the case that for a prolonged period of time, maybe 1 year, maybe 2, we have to be wearing masks, we have to be careful about not gathering in large crowds, then the effect will be tremendous. And freezing that sector for 2 years, for sure we won't be able to unfreeze it without some long-term damage. And so on that, we're subordinate basically to what the health measures end up being needed.
And again, this is fascinating, and I would love to hear back from you in a couple of weeks when we can see already some more behavioral change and adapt. I do think that there's going to be dramatic changes to the way that we think, even if the health measure comes back, I think that people will start rethinking about a number of things and what matters and what's important, what's not, and the way that traditions and rituals will be reinforced in a very different way. I want to finish, Ricardo, with one question about what do we expect from the U.S. economy in the next 6 months, and then also a lot a lot of US Hispanics, a lot of Hispanics and Latinos all across the world have their roots in Latin America. And so talk to us about like how to expect the US economy and then the consequences overall that you see in Latin America.
So I think the US economy, again, relatively soon, again, depends on the health uncertainty. There will be an unfreezing and we'll have a bit of a rebound, and then we'll see to what extent how much long-term damage was made. I mean, the US economy does have a virtue relative to many others, which is it tends to be a very flexible economy. It's not uncommon in the restaurant business in the US for restaurants to close for 3 months during the winter, fire everyone, people collect unemployment insurance, and 3 or 6 months later to rehire them. So this is not completely unknown to freeze and unfreeze in some sectors of the US economy. So if anything, one could be more optimistic on the US economy than in some others. Now, about the emerging markets, and especially the markets in Latin America that many of your listeners have very strong roots to. There, I have to say that I'm very worried. If one looks at the situation in Chile, in Bolivia, in Ecuador, in Brazil, in Argentina, in all of these, what you have is, one, that the health crisis is just about to hit them or hasn't quite hit them. But when it does, they're back of the queue in terms of getting the ventilators and all the machinery that we need, because we, the rich countries, have now bought everything and outbid them in all of those materials. So they're not going to have the same health capacity that we have. Two, in many of the cities, as you know, in Latin America, the population density is very large. So even the self-containment becomes a very difficult proposition when you have a whole family living in a small apartment and others. So in the urban centers of, say, think here of Mexico City, it's going to be very difficult to have an effective control of the virus. So that's on the health sector. But moreover, on the economic sense, there is no way that, again, the state capacity has to save all of these small businesses, especially the many in the informal sector. So the ability to freeze and freeze is going to be difficult. And on top of that, what we've already seen in the last few weeks is, one, a big appreciation of the dollar as people bring their money back to the US, which always causes trouble to firms in Latin America. We've seen very large capital flows, a lot of investors taking their money out of Latin America and bringing them back, which poses huge challenges to those economies in terms of their funding. And finally, thirdly, what you see in that is that in those economies, we are seeing that with the global recession, the less demand for their goods, especially as well with the fall in the price of oil, but as well of other commodities, is yet another shock. So for these economies, I am very worried because I see a bigger health shock than the one we're facing. And I see on top of it, the economic shock of the dollar, the capital flows, the demand, the price of commodities. So I actually see for them almost of a perfect storm in economic terms, and great difficulties ahead for them.
So the valuations expected, dollars, like the dollar going into the, to the roof and so on.
Yes, and that's what we've seen in the last 2 weeks, and so maybe the next month or two are going to be similar. And so that, I think, for instance, the reliance on remittances is going to be very high, especially from people in the US and others.
That's right. Ricardo, I have a last question, which is more personal. Would you accept an invitation to be part of the group of economists and thinkers that can get together to start drawing a recovery plan for the US Hispanics so that we can, again, get up back in our feet as soon as we can, when we can?
Sure. Well, subject to my knowledge limitations, I'm happy to help.
Absolutely. Ricardo Reis, Phillips Professor of Economics of the London School of Economics and Political Science. Thank you so much for being with us today. We will share this webinar with all the Alliance and the ambassadors that we have. For your knowledge and your time, I thank you. Thank you so much, everybody. Goodbye.
Thank you very much, Claudia. Goodbye.